Hi there, we're Netic Health, and we are the digital PT for active Americans. To understand more about our startup, you have to understand that we are in a seminal time for digital health and home health and wellness products. COVID has made everyone an early adopter. There's been 100x growth in telehealth. Hinge Health, which is one of our competitors in the digital PT space, a $3 billion valuation. There's also been a lot of movement in the regulation for telehealth that's allowed our business to really get at a great moment. It used to be that PT was only reimbursable when it was in person. Today, telehealth is approved for almost all PT codes, and there are new codes called an e-visit code, which allow clinicians to bill for chat-based interactions with patients. And our product is really going to step into this space. We're going to start with remote PT for runners. So the way it will work is you're a runner, you have a pain in your knee, you go on Netic, you find a physical therapist. You can do an all remote option. Maybe you can find a physical therapist with running expertise that's near you. You can pick your adventure, but you have your first visit in person or over Zoom, and then you do chat based care. And one of the big advantages of our product is because the care is so chat based and so convenient, it saves a lot of time for the patient, a 10x time savings. The other thing it does is it integrates the care and makes it better for the patient because you can find the exact type of clinician you want with little barrier and friction. You can get the expert exactly for your injury. The chat is integrated so that you can get holistic care based on your therapeutic exercise feedback and get quantitative scores based on your progress. And we're eventually going to build in automatic form feedback for both running form and for like therapeutic exercise form. And one of our biggest secret sauces is what we're going to do to PTs. We're going to supercharge them. So we're going to be able to automate a lot of the chat on the PT side. We're going to be able to give them a proposed and suggested courses of care using symptoms and other data. And we're going to be able to automate much of their documentation because so much of our care is transcribable. So we're going to 10x save time on the PT side. PT is going to handle more patients, make more money. Patients are going to be able to get care for less money, and everyone's going to win. How much traction have we gotten with a solution like this? Well, we've had 25 patients pay on some version of our solution currently. We are seeing 3x lower costs in PT time per patient already, 50% daily active use. And patients really seem to love our product. We're seeing people who weren't able to run and are now running 5-6 miles pain free. And that's why we think our NPS score is so high, even with the skinny product. So, in terms of go to market, we want to talk about the white hot center, which is injured runners. And why are we choosing runners? One, they have a hair on fire problem. Runners hate being injured when they like to be able to keep running. They're also very easy to reach. Runners are mean clubs, they mean races, they go to running stores, they're on apps for performance and social like Strava. And that's where a lot of our partnerships for customer acquisition are going to come from. We're already integrating with Strava. We have a partnership with a sales company that's going to try to incubate us in running stores and figure out a good way to disperse our product through fees there. Another thing that we're going to do after we conquer the runner market is move into the vertical of athletic Americans, which is a $30 billion market. And these are golfers, serious tennis players, cyclists, weightlifters. And we're going to be able to give care in a way that other companies can't compete with. And there's a few reasons we can do this. One, we're going to have an we're expert like network of PTs that can treat athletic people. Our care is going to be based on the holistic performance of the exercise and the change and moderation of that through the PT. And finally, we're going to be first movers in those B2C channels for running, and we're going to do the same thing in the other athletic channels. So the market's going to verticalize. We're going to see people go to Hinge if they have a chronic back problem. If you just want to talk to a random PT, you go to Physera. But if you are a runner or a cyclist, you want to keep doing what you love, you're going to go to Netic. In terms of PT acquisition, we have a lot of great places there. We have Run DNA, which can actually train PTs to become running PTs for us. We have a great relationship with APTA and the running interest group there, and a Runner's Mind and different running stores. We can acquire PTs through that ecosystem. So how are we going to make money? Well, every step of our care is going to be billable using CPT codes. Here's a list of them here. And it's going to be simple. We're going to have the patients through their membership fee pay copays. We're going to get insurance reimbursement. PTs are going to make a certain amount per patient per month. We're going to keep the rest. Even though our product is quick turnaround, we're already estimating high LTV to CAC ratios, around 10. And who's the team that's going to make this happen? Well, I am a Haas MBA, former film entrepreneur, so second-time founder. Matthias is a medical doctor. He's done research at Harvard. He has awards from Stanford Biodesign. And Val is a former Apple developer, our CTO, and he's also done some healthcare startups before. And what is our ask? Our ask is opportunities to meet with investors, for partnerships with places to disseminate our product, and all other such things that will help us kind of help Netic make progress and move forward in a strong way. Thank you.